Your body is speaking, soft hints that something is off. A painless lump that showed up last month, night sweats that soak your sheets. Weight slipping away without a clear reason, these aren't random events. They're urgent signals from an immune system under heavy strain. Each year, roughly 81,000 Americans learn they have non-Hodgkin lymphoma. Too often, early clues are brushed aside for months as stress, aging, or minor health blips. The gap between catching this cancer early and facing an uphill fight often hinges on recognizing 12 commonly overlooked symptoms. You've arrived at a channel devoted to life-saving health education. If this is your first time here, you've found a trusted source for essential medical insights. Tap subscribe and turn on notifications. The information we share could make a critical difference for you or someone you love. Tell us in the comments which country you're watching from, and help us build a global community focused on health awareness. Today's video is designed to turn everyday viewers into informed advocates for their own health and their families. By the end, you'll be equipped to spot lymphoma's earliest alerts, knowledge that can mean the difference between timely treatment and a dangerous late-stage diagnosis. This content is for educational purposes and is not a substitute for medical advice. Now, let's break down the symptoms of non-Hodgkin lymphoma. 1. Easy bleeding and bruising. When lymphoma involves the bone marrow, the body's ability to form clots can be markedly impaired, resulting in easy bruising and bleeding that lasts longer than normal. Around 20% of patients experience these problems as the disease disrupts platelet production or function. Even small bumps may cause large bruises, minor cuts can bleed for an extended time, and some people may have spontaneous bleeding episodes. Studies reported in the Journal of Clinical Oncology indicate that bone marrow can be affected either by direct infiltration of cancer cells or by immune dysfunction. Malignant cells may crowd out healthy blood-forming cells, and certain lymphomas can provoke immune attacks against platelets. Together, these mechanisms create a hazardous bleeding tendency that can become life-threatening in severe cases. Warning signs include bruises appearing without any recalled injury or existing bruises that fade very slowly. Additional symptoms can involve frequent nosebleeds, bleeding gums, heavy menstrual flow, or pinpoint red spots on the skin, petechiae. These tiny areas of skin bleeding signal a significant shortage of platelets. 2. Recurrent infections. Because lymphoma weakens immune defenses, patients become susceptible to illnesses that most healthy people would quickly overcome. Roughly 25% experience infections that are frequent, unusually severe, or slow to resolve as white blood cells lose their effectiveness. These episodes can be bacterial, viral, or fungal, and they often prove harder to treat than usual. Findings from the National Cancer Institute note that people with lymphoma may develop opportunistic infections rarely seen in those without immune compromise. Routine problems like colds or urinary tract infections may linger, require antibiotics, or return repeatedly. This trend of getting sick more often emerges gradually, making it easy to blame stress or environmental exposure. Even minor infections may need medical treatment or hospitalization when they once would have cleared on their own. This heightened vulnerability reflects cancer's direct attack on the body's defense system and should trigger prompt medical evaluation. 3. Unexplained itching. Among lymphoma's most exasperating symptoms is a relentless, widespread itch that appears without any obvious skin changes. About 15% of patients are affected, and the intensity can disrupt sleep, productivity, and everyday life. Unlike ordinary irritation, this pruritus is strikingly severe and often resists standard remedies. According to research cited by Lymphoma Action, The itch stems from inflammatory chemicals released as the immune system reacts to cancer cells. These mediators heighten the sensitivity of nerve endings, producing powerful itching even when the skin looks normal. The sensation may be generalized across the body or confined to particular regions. Because there's typically no rash, diagnosis can be difficult. Many people try multiple over-the-counter treatments without relief, leading to frustration and delays in seeking care. The itching commonly intensifies at night, further disturbing sleep and contributing to fatigue. 4. Shortness of breath and cough. When lymphoma causes lymph nodes in the chest to enlarge, normal breathing mechanics can be disrupted. About 30% of patients develop shortness of breath, a persistent cough, or both as the disease involves the thoracic region. These problems may be as mild as reduced exercise tolerance or as severe as difficulty breathing even at rest. Evidence from medical literature notes that the cough is usually dry, ongoing, and resistant to typical treatments. It often worsens at night when lying flat, a position that increases pressure on already narrowed airways. In some cases, fluid can accumulate around the lungs, further impairing breathing and adding to respiratory distress. Breathlessness often begins subtly, appearing first with exertion before advancing to interfere with everyday tasks. Because this progression is gradual, it is easy to attribute the symptoms to aging, low fitness, or other harmless causes, which can delay recognition of the serious underlying condition. 5. Chest pain and pressure. When lymphoma spreads to the mediastinum, the space between the lungs, enlarged lymph nodes can compress vital structures and produce potentially life-threatening symptoms. In this setting, about 20% of patients report chest pressure or pain, breathing difficulty, or both. The clinical picture ranges from mild discomfort to situations requiring urgent medical care. The American Cancer Society notes that mediastinal involvement can squeeze the trachea, major blood vessels, or even the heart. Rather than a sharp, stabbing sensation, patients commonly describe a heavy fullness or tightness, as if a weight were pressing on the chest or a band were cinched around the upper torso. These symptoms often intensify when lying flat or during physical exertion. In severe cases, blockage of the superior vena cava, the large vein that returns blood to the heart, can occur, leading to superior vena cava syndrome, a medical emergency that demands immediate treatment. 6. Abdominal pain and swelling. Lymphoma involving the abdomen often mimics routine digestive troubles. As lymph nodes, the spleen, or the liver enlarge within the abdominal cavity, they can produce a steady ache, noticeable swelling, and a persistent sense of fullness or pressure. This pattern appears in roughly 25% of patients and may be the earliest sign of disease activity inside the body. Evidence summarized by the American Society of Hematology shows that abdominal lymphoma can present with a wide spectrum of discomfort, from a mild, continuous ache to sharp, severe pain. Enlargement of the spleen typically creates fullness in the left upper abdomen, while liver involvement commonly causes right-sided pain. The discomfort is usually constant and not linked to meals or bowel movements. As organs and lymph nodes grow, visible distension can develop, and clothing may feel tighter around the waist. Unlike ordinary bloating, this swelling tends to persist and gradually worsen. The discomfort often disrupts sleep, especially when lying flat, and can significantly interfere with daily activities. 7. Loss of appetite. When lymphoma takes hold, your relationship with eating can shift dramatically. It's not just feeling less hungry, you may develop a strong aversion to foods you once loved, feel full after only a few bites, or even experience nausea triggered by the sight or smell of food. This occurs in about 40% of patients and often emerges early in the course of illness. Studies from Cancer Research UK indicate that lymphoma disrupts appetite regulation through several mechanisms. Cancer cells release compounds that interfere with normal hunger cues, while enlarged abdominal lymph nodes can exert physical pressure on the stomach. In addition, the body's inflammatory response alters hormones such as ghrelin and leptin, which govern appetite and satiety. Left unchecked, this diminished appetite fuels a harmful cycle, unexplained weight loss, and nutrient shortfalls that undermine the body's capacity to fight cancer. The emotional toll of losing interest in food can be just as challenging, straining social connections and diminishing overall quality of life. 8. Fatigue. Lymphoma-related fatigue goes far beyond ordinary tiredness, a deep, unrelenting exhaustion that touches every part of daily life. It often creeps in gradually and is easy to misattribute to stress, aging, or lifestyle. Updated data suggest this problem is widespread. Roughly 7 in 10 people living with lymphoma report life-impacting fatigue, and about 30 to 60% experience it during active treatment, with 20 to 30% finding it lingers for months or even years afterward. Multiple processes drive this depletion. Tumor cells siphon oxygen and nutrients from healthy tissues, while the immune system's constant fight against cancer consumes energy. Inflammatory signaling tied to the disease and its treatments can also suppress red blood cell production, leading to anemia that worsens tiredness. Together, these pathways create a perfect storm of physical drain that sleep doesn't fix. People often describe the sensation as moving through wet cement. Every simple task demands outsized effort. The physical weariness is matched by mental fog, with concentration, memory, and decision-making all taking a hit. Because the severity can wax and wane unpredictably, it's particularly hard to manage and easy to overlook as a sign of serious illness. 9. Night sweats. In lymphoma, night sweats are far more than ordinary perspiration during sleep. They can be so heavy that clothes and bedding are soaked, no matter the room temperature. Current references suggest these drenching sweats occur as part of the lymphoma B symptoms cluster in a substantial minority of patients, roughly 1 in 3 at presentation in non-Hodgkin lymphoma and up to about 30% in Hodgkin lymphoma. The underlying driver is inflammatory signaling tied to the cancer and the immune response. Cytokines and other mediators can disrupt normal temperature control, which is why these episodes are typically more intense than menopause, or anxiety-related sweating and often do not respond to simple environmental adjustments. People often describe stretches of nightly episodes that can persist for weeks, sometimes easing for a time and then returning. Beyond the physical discomfort, the repeated sleep disruption fuels daytime fatigue and emotional distress, amplifying the overall impact on quality of life. 10. Fever. In lymphoma, fever often behaves like a phantom, appearing abruptly, then receding, only to flare again days or weeks later. Rather than the steady, sustained patterns seen with many infections, these spikes are characteristically intermittent and unpredictable. This on-again, off-again course reflects the body's reaction to cancer cells. Inflammatory cytokines drive prostaglandin production, which signals the hypothalamus to raise the internal set point, producing fever as part of the immune response to malignancy. Updated estimates suggest that unexplained fever affects roughly 1 in 3 people with lymphoma overall, and about 35% of those with Hodgkin lymphoma at presentation. Episodes may persist or recur despite routine measures and can be accompanied by chills, sweating, and a general sense of illness. Because unexplained or persistent fever, especially alongside other suspicious symptoms, can signal active disease, prompt medical evaluation is essential, Many guidelines advise urgent assessment for temperatures above 100.4 degrees Fahrenheit 38 degrees Celsius. 11. Mysterious weight loss. Shedding 15 pounds without trying can feel like a lucky break, until the scale keeps sliding despite normal, or even bigger, meals. When weight continues to drop for no clear reason, it often signals something far more serious unfolding inside the body. In lymphoma, unintentional weight loss is one of the classic B symptoms, defined as losing more than 10% of body weight over 6 months without deliberate changes. Current references indicate this feature appears in roughly 1 in 3 people at diagnosis, with rates varying by subtype. The biology behind this is not simple dieting in disguise. Tumor and immune-driven inflammatory signals can hijack metabolism, pushing the body into cancer cachexia, a hypercatabolic state marked by ongoing loss of muscle, and often fat, that isn't fully reversible with nutrition alone. Unlike intentional weight loss, this decline tends to be steady and relentless, often accompanied by visible muscle wasting and overall physical decline. Left unchecked, the body breaks down tissue faster than it can rebuild, creating a downward spiral that erodes strength and resilience. 12. Painless swollen lymph nodes. Your lymphatic system works as a quiet sentry, filtering threats and supporting immune defenses. When lymphoma disrupts this network, one of the earliest red flags is often painless swelling in the lymph nodes of the neck, armpits, or groin. Unlike the tender, sore nodes common with infections, lymphoma-related enlargement typically occurs without discomfort, making it alarmingly easy to overlook. These nodes usually feel firm and rubbery, ranging from the size of a pea to larger than a golf ball. The lack of pain can lull you into dismissing them, yet that very feature is one of lymphoma's most troubling hallmarks. Large cancer registries report that this sign appears at presentation in roughly 7 out of 10 patients, making it the most frequent initial warning. What's happening beneath the surface is gradual expansion as malignant cells proliferate inside the node. Surrounding tissues adapt to the slow growth, so pain receptors aren't triggered. As a result, the swelling can persist for weeks or months before medical attention is sought. Nodes may appear singly or in clusters and can sometimes be seen as visible lumps beneath the skin. Now that you know the 12 red flags, you hold something powerful, the ability to act before problems escalate. If one or more of these symptoms persist beyond a few weeks, or if several show up together, don't wait for them to sort themselves out. Book a medical evaluation and ask about appropriate tests. Early answers bring clarity, relieve anxiety, and most importantly, open the door to more effective treatment options. Be proactive with your health, keep a simple symptom journal, note what you feel, when it started, and how often it occurs. Bring those notes to your appointment so your clinician sees the full picture. If you're supporting a loved one, share this knowledge and encourage them to get checked. A calm conversation today could prevent a crisis tomorrow. Remember, awareness is contagious. Someone you know may be quietly dealing with night sweats, unexplained weight loss, or painless swollen nodes and dismissing them as just stress. Send them this video. Your care could be the nudge that gets them the help they need. If this video helped you, please type helpful in the comments. It tells us to keep making content like this. Give the video a like, share it with friends and family, and subscribe to the channel. Tap the notification bell so you never miss practical, potentially life-saving insights. We release new, easy-to-understand guides that empower you to take charge of your health and to advocate for others. Thank you for investing your time in learning these warning signs.